Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the cystic fibrosis. The cystic fibrosis is an autosomal recessive disorder with extensive damage to the exocrine glands. So, this is an autosomal recessive disorder with extensive damage to the exocrine glands. Okay. This is a devastating disease. It is devastating just second to the sickle cell disease in the childhood. Okay. So this is an autosomal recessive disease caused by mutation in the CFTR gene caused by mutation in the CFTR gene, okay, that encodes cystic fibrosis transmembrane regulator, that encodes cystic fibrosis transmembrane regulator. Okay, we got that. So this is an autosomal recessive disorder with extensive damage to the exocrine gland caused by mutation in the CFTR gene that encodes cystic fibrosis transmembrane regulator. Okay, we got the definition and cause. The principal defect is in the chloride ion transport. The principal defect is in the chloride ion transport. Okay. Resulting in high salt concentration in the sweat gland. Resulting in high salt concentration in the sweat gland. Okay, so a newborn baby or infant has the sweat with very much salt in the sweat. So the infant's mom complained that my baby, my infant, is salty infant because of loss of salt is coming out through the sweat gland. So we get salty infant, and that is complained by the infant's mother, infant's mom. Okay, so we'll get that, and along with this we'll have viscid or concentrated mucosa, viscid secretion concentrated mucosa is present. Okay, the mucus secretion in the respiratory tract and the gastrointestinal tract become very concentrated. Viscid secretion deposited in the respiratory system and gastrointestinal system. Respiratory and gastrointestinal tract system. Okay, so we get there will be very much viscous luminal secretion. We can call viscous luminal secretion. So we got salty sweat plus viscous luminal secretion deposited in the respiratory and gastrointestinal system, gastrointestinal tract system. So this is the mechanism of cystic fibrosis. There is mutation with variable expression. So CFTR mutation resulting in multi-system problem. CFTR mutation. Okay, we have CFTR mutation and that result in multi-system disease. Okay, so CFTR mutation, and that shows mutation with the effect on multiple system in multiple system. Okay, so that may happen. The locus is present in chromosome number 7, the long arm of the chromosome number 7. Okay, we got that. So it can be very severe or it may be manifested in a mild form. So it is very much protean, so that it is manifested in some individual very much severe, all system may be affected. In some other individual it may not be very much severe, it may be very mild, that is also possible. Okay, so we got that. Then we go to the system. What is the problem? Okay, we'll go through that part. So cardiopulmonary complication is the cause of death. Cardiopulmonary complication is the cause of death. Okay, and this is a disease of the white population. A disease of white population, like that of sickle cell disease, is a disease of the people from African origin. Here, this disease is a disease of white population. It is rare among the Asians and African Americans. Okay, in the white population, it is manifested 1 in 2,500 people. Okay, we get the cystic fibrosis. Okay, and it is diagnosed on average around 5.3 months after birth. Okay, mom complained the infant is salty, and longevity is around 30 to 40 years with support. Okay, so lifespan of a patient with cystic fibrosis with all medical facilities. Okay, maybe 30 to 40 years. It varies from person to person. Okay, we got that. It is a disease of the white population. Okay, we got that here. Then we go to the system where it is affected. It affects the sweat glands. We discussed it will be very salty. Why salty? This is the duct cell of a sweat gland, normal duct cell. What happened? The chloride ion get in because CFTR gene and the protein is okay here. Sodium is getting in here. Okay, in case of cystic fibrosis, the chloride cannot get into the ductular cell, epithelial cell. Sodium cannot get in, so there will be salty here. The sweat contain a lot of salt. Okay, so it's a sweat will contain a lot of sodium chloride, more than usual. Okay, it will be very high because chloride, sodium cannot get in. It is staying outside. Okay, so that is the region, sweat gland, all over the body, not only on the forehead. Entire body sweat gland will show excessive sodium chloride. Okay, we got that. Then we have every chance, our patient has every chance to get sinusitis, that is inflammation of the mucosa of the paranasal sinuses. Okay, that is a possibility. And then we go one by one. Is the lungs. Lungs may have lung abscess, pneumonia, bronchiectasis, so we get lung abscess, pneumonia, bronchiectasis, and it's because it is a chronic lung problem. In the finger, we'll get clubbing of the finger. Patient will show clubbing of the finger. Okay, and it's because it will lead to the emphysema. Okay, emphysema. So we get in this person emphysema and COPD. Okay, chronic obstructive pulmonary disease. This is lung. Another lung is here. So we get that, and in the finger we get the manifestation. That is called clubbing of the finger. There is a manifestation of chronic heart and lung disease. Okay, we'll get that. So we also remember that in case of cystic fibrosis, it is found that they are prone to develop all type of cancer more than that of the general population. Okay, so we get the bronchiectasis, pneumonia, emphysema, chronic obstructive pulmonary disease, and we get right-sided heart failure eventually. Right-sided heart failure. Okay, so that is a possibility. Okay, it's because we have called pulmonary. You get that problem here. Okay, so lung problem is very common, so there will be always chronic cough. That will be a complaint of the patient, chronic cough, and low growth, failure to thrive, low growth, and chronic cough. That is a common finding, and certainly we discussed that clubbing the finger. Clubbing the finger, there is a manifestation of the chronic disease in the heart and lung. Okay, we got that. So then we go to find out the liver. This is the liver. In liver, what happened? in liver will get cirrhosis of liver, but this happens the later part of the life, not at the beginning. At the beginning, the lungs and the sweat glands are affected. Okay, so cirrhosis of liver that may happen in the late manifestation. There will be gallstone cholelithiasis, gallstones development. There is cholelithiasis. We may add here in this person, the person is cystic fibrosis. They will have nasal polyp, and malfunction of the salivary gland malfunction, because it is an exocrine gland, whether the parotid gland, submandibular gland, sublingual gland. So salivary gland malfunction, we will call dysfunction. Okay, because all the duct will contain the thick viscous collection, and there will be metaplastic change in the epithelium, so there will be dysfunction here. Also, this person eventually also get rectal polyp. There is a possibility also. So we got liver problem. Now go to emphasize on the pancreas. There will be damage to the pancreatic ducts will be blocked with thick secretion. Pancreatic ducts will be blocked. Okay. So there will be blockage of the pancreatic ducts and there will be metaplasia of the cells. Okay. So, and destruction of the exocrine part. Of the exocrine pancreas. Okay, how about endocrine pancreas? Endocrine pancreas is the islets of Langerhans, the endocrine pancreas. It releases hormone that will also be affected on the later part of the life. So there will be diabetes mellitus because of damage to the islets of Langerhans. Initially, exocrine pancreas will be lost and there will be just fibrous tissue. Islets of Langerhans will function initially. Eventually, it may not function and there will be destruction of the islets of Langerhans, and there may be establishment of diabetes mellitus. Okay. One important point from the pancreas, because this is pancreas. Pancreas secretes the enzymes that is essential for the absorption of the fat-soluble vitamin. So this patient of cystic fibrosis will lack vitamin A, D, E, K. All fat-soluble vitamin will be lacking because of lack of exocrine pancreas, because of lack of the pancreatic enzymes. So these all will go down. Okay, so this patient will suffer from A vitaminosis, so lack of vitamin A, D, E, and K. Okay, we got that problem. Now we go to the intestine. Okay, so before going to intestine and respiratory system, what happened? This is the goblet cell that releases the mucus here. What happened in a normal cell? Person no cystic fibrosis. The chloride will go out from the respiratory system respiratory and gastrointestinal system, GIT system. Okay, so what happened? Normal cell, this is the goblet cell, this releases the mucus, this is mucus. Okay, mucus, and here from the cell we are getting the epithelial cell, we are getting the chloride, water getting in less amount, and sodium getting in. But in case of cystic fibrosis, what happened? This is the goblet cell, releases mucus. Mucus become very viscid and hard. Why? Because too much water get inside the cell, and the chloride cannot go out of the cell in the respiratory system and gastrointestinal system. So there will be thick mucosa in the exocrine glands that happens. Okay, so that is the problem, and we got that is blocking the bronchiole, that is blocking the hepatic duct and ductules. Okay, and also pancreatic duct and its ductules, that will be blocked due to thick mucosa here, because water is getting in very much large amount and chloride cannot go out. Okay, just sodium is getting in here, and that is the reason for thick viscid mucus in the respiratory system and gastrointestinal system. Okay, so what will happen in around 5 to 10% cases? The newborn born with meconium ileus. Okay, there will be blockage of the intestine by the fecal stool. Okay, that may happen due to intrauterine changes in the intestine. Due to cystic fibrosis, there will be collection of thick mucus. Suppose thick mucus is blocking the passage. Okay, so that will lead to intestinal obstruction and meconium ileus. Around 5 to 10% newborn it is seen. Okay, we got that the systematic problems associated with cystic fibrosis. Okay, now we have to know how to diagnose it. Diagnosis by sweat test. We can give some pilocarpine so that we can stimulate the sweating, and that will contain a lot of sodium chloride. Okay, then we can diagnose by DNA analysis. Ideally, both the partner parents and other first relatives, close relatives, should be tested for the gene, defective gene, DNA analysis. Okay, we can diagnose that way. We have to do the chest X-ray. You will find out the bronchiectasis, bronchitis, or lung abscess. We can easily diagnose that part. Okay, so by means of the chest X-ray. So once we have diagnosed, then we can do also CT scan if it is essential. Do it. Okay, so once we have done the diagnosis, then we'll go through the management. It is a lifelong management. It needs chest physiotherapy so that the secretion in the lung should go out naturally. Physiotherapy. Antibiotic is essential, because there is this cystic fibrotic infant or boy or the person will have chance to get the bacterial infection in the lung, especially by Pseudomonas aeruginosa, maybe by Streptococci or Pneumococci even. Pseudomonas aeruginosa. Okay, so there is possibility of Pseudomonas infection, and we'll get the mucosa color, green color mucosa, or not only Pseudomonas, we also get another type of Pseudomonas type that is called Burkholderia. Burkholderia. That is even more devastating. Okay, so that species will cause more problem. Okay, so we get this problem here in the lung. So our patient management antibiotic is very important, but the problem is that due to long-term antibiotic, there is possibility of antibiotic resistance. Physician always take care of that part. Okay, then we got chest physiotherapy antibiotic, and as because our exocrine pancreas is not working, no enzyme here, no absorption of vitamin A, D, E, K, so we need the pancreatic replacement therapy. Okay, pancreatic replacement therapy. Okay, by some enzymatic preparation we can give that. Okay, at one time we may need lung or heart lung and liver transplantation that may be repaired. And the last of all, there is now some type of promising result. It's not well established, but on the horizon, it is called molecular therapy. Okay. Therapy is coming. By the meantime, in the patient management, we have another inhalation that is called Dornase inhalation. We can add there. Okay, Dornase inhalation. Dornase, even the hypertonic saline inhalation, that will also work. Hypertonic saline inhalation, both, either this or that inhalation, that also a good way to manage. That is the recombinant human deoxyribonuclease preparation, the Dornase. This is simple hypertonic saline inhalation that will work. And we need the genetic counseling. Okay, genetic counseling is very important because it is autosomal recessive disorder. Okay, and we must know that in case of genetic counseling, very, very important. And we must know that in case of consanguinity, chance of getting cystic fibrosis is also increased. Okay, so that's all about the cystic fibrosis. If you have any question, please feel free to ask me. Share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.